So I work closely with lots of different types of healthcare providers. So sometimes it's just collaborating on, have you seen their blood work? Did you see that? How do you feel about those numbers? Or have you been in touch with them? They need their immunization. Will you do that? Will I do that? Or, I'm concerned about this patient because they're having these sort of symptoms, and it's just a very informal. Other times it's us actually sitting down and developing a plan with that patient and the two of us together.
In 2006, I left a practice that I'd been at for 10 years and decided to open up a clinic here in Trail. One of my motivations for doing that was to create a clinic that was a little different, that involved integrated a nurse practitioner, and also was a teaching clinic for residents of family practice, for medical students, and for nurse practitioner students as well. The thing that struck me the most when I started working with an NP was just the sense of relief from shared responsibility. I felt like as a practitioner prior to working with an NP that I was very isolated, almost lonely, working in a bit of a silo. I certainly had relationships and connections with other physicians and other care providers in the community, but not that kind of collaboration that exists in real time and working with an NP.
So within residential care, our focus is a shared care collaborative model with physicians. So working together with physicians, partnering together to provide the best care for these residents.
I just can't imagine being able to function as well without them. And they've become accepted by our colleagues cardiologists as well as part of the integral part of the team, so that when cardiologists call for a patient to be seen by your surgeons, they're not surprised to see the nurse practitioner come and start to do the consult.
2014, I went in for just a regular routine checkup, and I flunked the stress test. And went from there, had another angiogram, and it was discussed that I would need bypass surgery.
My experience with a nurse practitioner was great.
I've always been a believer in teams, and I find that when we do things together, there is a higher success rate in achieving our goals of care, and there's also more safety for the patient.
So if I was to give advice to one of my colleagues about that is thinking of potentially hiring NP or getting involved with the program, my advice would be to embrace it. It's only going to improve the quality of the program.